Registered 124,864 cumulative confirmed cases of COVID-19, a total of 96,321 recoveries, and 3,179 deaths. Currently, there are 239 patients admitted in health facilities countrywide. Furthermore, the positivity rate has dropped from 21%, which was the highest in this second wave, to an average of 3.4% in the past 10 days. The dominant variant that is circulating in the country is the Delta. The daily average number of confirmed cases over the last 1 month has declined and stabilized at 124 cases countrywide. That is the daily. From an average of 1,445 cases at the peak of the second wave in June 2021. Similarly, the daily average number of deaths has declined to 6 from 57 deaths at the height of the second wave. This means we still lose on average 6 people every day. While the country continues to register a consistent drop in the number of confirmed cases since the peak of the second wave in June 2021, we have not yet reached where we were at the beginning of the second wave, because at the beginning, the curve was almost flat. Now we are not back to that level. Analysis of the COVID-19 data by our epidemiologists revealed the following. More females have been infected with COVID-19 in the second wave than males. In the first wave, it was more males than females. Hospitalization and death due to COVID-19 is predominant among those aged 50 years and above. And 61% of those who died in the COVID-19 treatment units had comorbidities such as hypertension, diabetes, and HIV. In the last 2 months, September and October 2021, 3 regions have been registering increasing numbers of confirmed cases and an increase in the number of affected districts in these regions. This points to a resurgence, and these districts are being followed up very closely as hotspot areas. The affected regions with pockets of intense transmission include Kampala City, Teso sub-region, and the affected districts are Soroti, Katakwi, Ngora, and Kalaki. Acholi sub-region, and the affected districts are Amuru, Gulu, and Nwoya. And then we have Lango sub-region. The affected district is Oyam. The main drivers of transmission in these districts have been identified as mass gatherings, for example, burials and weddings, weekly markets, the subsequent social activities and interactions, including drinking alcohol after market days, are acting as drivers of transmission. And we have widespread use of local remedies that have created a false sense of security and delayed seeking of care at the health facilities, and failure to follow standard operating procedures and congestion, especially in the city center. In response to the emerging resurgence in the above-mentioned districts, the Ministry of Health has intensified response activities such as deployment of surge teams, increase in amount of medical supplies and personal protective equipment, scaling up mobilization for vaccination of priority groups, and enforcement of standard operating procedures to ensure that the outbreak does not spill over to the neighboring regions. The National COVID-19 Response Strategy. The National Task Force continues to employ a multi-sector approach to control the pandemic. In this regard, the response strategy currently focuses on the following. 1, enhanced surveillance in all districts for early identification of hotspots areas, and at the points of entry for prompt detection and control of imported variants. The Ministry of Health continuously carries out genomic sequencing on samples removed from travelers and selected samples from among the population. 2 is improved care for the confirmed cases. The Ministry of Health experienced high patient numbers, inadequate oxygen supply, insufficient bed capacity, and catastrophic expenditure in the private facilities, with retention of dead bodies during the second wave. To address this, the ministry is fast-tracking installation of high-volume gaseous oxygen plants in Mulago and all regional referral hospitals, and liquid oxygen plants as a long-term plan. In the interim, adequate cylinders have been procured and will arrive in the country soon to be distributed to all COVID-19 treatment units. Bed capacity is being enhanced by preparing selected district hospitals in hard-to-reach areas and islands to handle COVID-19 patients, as well as train more health workers.